Joining us this morning from ACMC Hospital is President and CEO of ACMC, Mike Habowski. Did I say that right, Mike?
Oh, perfect. You're getting good, Pat.
Okay, now's the challenging part. And also the Vice President of Business Development at ACMC herself is Tina Stachewski.
Yes, A+.
Yeah, all right. And Tina's been on the show many times before. Mike, you were here last year.
Yes, I think this is my third time, I believe.
Is it third time?
Yes.
And what we thought, what we usually do, because this is the last appearance for ACMC for 2012, because of the holidays coming up and all that, we thought we'd do a little year-end roundup. So Mike, I'll turn it over to you.
Great. I put a few notes down, Pat. It's been a great year. I've been at ACMC a little bit over a year now, and I think our biggest story of the year, if you needed an end-of-year headlines, would be physician recruitment. We took a look at the community, what our needs are, what our community members and patients were telling us, and I'll just run down a quick list. And you've met several of these folks on your show. But pediatrics was a big area for us with Dr. Ashtabula coming. Dr. Andy, family practice down in Jefferson. Dr. Bibadakis, if you remember him from Greece, general surgery, he came over with his wife and 5 children, and they are thriving. Dr. Brojmahan is pretty recent in psychiatry, does both outpatient and inpatient. Dr. Papsadero, this was a big need that we filled, was our ENT.
He's been on.
And he has been on, yes. Dr. Stevens in cardiology.
Great guest.
Yes, from Cleveland Clinic Cardiology, but based at ACMC full-time. And a new one that you haven't met yet is Dr. Thompson, OBGYN. Very well experienced, 9 years experience out in OBGYN and a lot of surgical specialties, and we hope we can get her on sometime.
Okay.
I think you'll find her very interesting. So our story on that is not just bringing docs in, but these physicians are full-time. They're at ACMC, full-time, here to serve our patients. Something that you don't think about, though, is that it's not just office visits. What this has done is also provided all these specialties emergency department coverage. Because when somebody comes into the emergency room, if they need a specialist, which a lot of times they do, those specialists need to be available. So when the ED physician says, hey, I need a cardiologist or I need an ENT to be in here, we have these people on call now, and I think that's a great advantage to our community.
Mike, are all 7 of these then, they're all based out of ACMC?
They're all recruited and full-time at ACMC.
Wow, that's amazing.
Yes.
Yeah. Let me ask you this then, because I don't know how it works, but how do you recruit? I mean, do you have a team that goes out and gets these?
That's a great question. As you know, we have about 30 employed physicians, so we have, we call it an infrastructure that works with our physicians, all our employed physicians, but we do have a vice president that works with our physician group who does a lot of this recruiting, and his name is Leonard Stepp. Janet Vettel also works with, you know Janet? I think everybody knows Janet. Works closely and really takes the lead in a lot of recruiting. And I'll tell you, Pat, I get involved personally. I think it's really important that when you're talking to physicians, especially ones that have made big decisions to come from outside the area and set up their practice in Ashtabula, I think they do want to talk to the CEO.
Yeah.
So I spend a lot of face time. And I have to give compliments to our medical staff. When physicians come into the area, it's nice. They want to, they do want to meet the CEO, but they want to talk to who their colleagues are. So I am so thankful that our medical staff physicians have actually said, I'll participate in a dinner or I'll show them around the area. They get very involved, and I find that collegiality often is what makes a physician decide, hey, you know what, I think this is going to be a good place for me to practice and bring my family. So
I know one of the promotions that you've done, probably through Tina and others, is the dinner with the doc. That seemed to be very popular.
Yes, we've actually had people calling in saying, is there one this month and when do they start next year?
Really?
It's it's great. It's a smaller setting, no more than 12 people. I think we extended it to 16 for Dr. Capsadero because it was so popular. But we want it to be small so that you have some more closely to one-on-one time with the physician. And the physicians have been responsive to it. The community has embraced it. They come to the hospital. Our nutritional services department caters the dinner. And it's just a casual conversation with the physician. It's not a PowerPoint presentation. You're sitting down over a meal. You get to meet them as an individual, not just as the doctor. And you don't have that white coat syndrome where you met the doctor the first time going into the exam room because there's something wrong.
Right.
You can ask those questions up front. And you know what? It's almost like an interview process. You get to determine what that physician's personality is like and whether not just that they're clinically what you need them to be, but that you're going to be able to work with them because you have to be an advocate for your own health.
Are the physicians receptive to doing this?
Yes, yes, they are.
They're not shy?
No, not at all.
Great.
And they have seen patients come from it.
Is that right?
So it's beneficial for them, and like I said, the community has really embraced it.
You know, and I've never actually seen that many recruitments and I've covered this town in the county for many, many years. I've never seen that many recruitments in 1 year.
Well, I have to dispel a myth. If I can use this show, really, and it's a myth that still continues. I had somebody say it this week to me. It must be hard to get a physician to come to Ashtabula. Well, the answer is no.
Really?
It's not.
How do you sell them?
Well, first of all, when physicians come out, first of all, you get a little surprise factor because they're coming to a smaller community. But then when they see what goes on at the hospital, the scope, the range of services, they see we have a large emergency department. They see psych, they see cardiology, they see ortho, they see the breadth of specialties. If they don't see that, they're not going to come here. So if you have say a family physician that comes in, he wants to be able to make sure that if somebody needs an orthopedic person, a cardiologist, that you're going to have them, and that you're going to have them available in your community. So
how about as far as the ambience of the county itself? We're a rural community. A lot of these doctors are probably from bigger towns.
They are.
Do they accept this small town?
It depends. Some look to head a little bit to the west because it's closer to the city. But I have to tell you, we have several that said, "I'm looking for the open land." We have somebody that's seriously considering. I don't want to give it all away. Seriously considering coming to ACMC for a much-needed specialty. His requirements. He's talking to me. He says, "Well, I want a lot of acreage. I think we can do that. I want a horse barn. My family has horses. Really? I think we can do that." When he saw the area, he was really pleased.
Great.
And I think the area is going to be an attractive too. So, believe it or not, several physicians like what they see out here. They like the lifestyle, the lake. They love the lake.
The ones that I've interviewed have said that to me.
Yes.
That they like the rural. And one of them, I can't remember which one it was also interested in some land and lived more out south than here. But
so some physicians do have different choices, but all in all, they like what they see, both at the hospital, and they love the people of Ashtabula County. I don't know if you remember this, Pat. What every physician who comes here has told me is we have never felt so appreciated by our patients.
Really?
And I don't care if you're a Cleveland Clinic physician, if you're a family physician just coming out of school, they all say the same thing.
Yeah. Yeah.
So that's a credit to our community.
The other thing that your doctors have mentioned to me is the lake. They
Yes.
tend to like the lake.
They do.
Even the ones that are just driving down here,
Mm-hmm.
they just like looking at the lake when they go on Lake Road, which I think is neat because I take it for granted,
We all do, I
like
think.
here,
You do every time I come out here, Pat. Today, Tina, we got to take the road that goes past the lake road up here, which we did this morning.
Yeah,
and
did you?
We really enjoyed it. It just relaxes me, and it's a very nice setting.
Good. Well, that's a very big plus here. 7 recruited physicians here at ACMC. What else you got going, Michael?
Okay, I'll try to give the highlights and Pat ask questions as we go along. But a big one was our electronic medical record. We've moved from a paper chart now to Cleveland Clinic's electronic medical record system called Epic. So again, a credit to our physicians who have to use it and our nurses and other staff at the hospital. But we're up and running, full speed. We did something that many of the other Cleveland Clinic hospitals did not do, or most hospitals did not do. We went totally electronic at once. Some examples are not just the nursing department, but some of the lab, radiology, pharmacy, operating room, emergency department. Electronic all at once. We were a little shaky to say, hey, can we do this? And it went exceptionally well.
Did it?
And what does that mean? Physicians have a lot of information at their fingertips immediately. Whether you're had your test done anywhere in the Cleveland Clinic Health System or at Ashtabula. I'll tell a little personal story real quick. My son had a CT scan done at Ashtabula and needed a service that he had an established physician at Cleveland Clinic main campus, and he needed a surgical procedure. How cool was it? They took me back in the OR and they showed me the electronic screen, and there was ACMC's CT scan that was done on my son sitting in the Cleveland Clinic OR. I was proud. I was just proud to see that technology and what it does for patient care. So we can push it there, and their images, boom, can get pushed up to ACMC for procedures that are done there. So it's information to our physicians.
Now, of course, all of us have seen this technology just keep growing and growing and growing so fast. So in the old days, they would have had to do it by delivery or carrier? Or?
Take a chart, do a phone call. It wouldn't have been as instantaneous as it is now. As soon as that x-ray is taken, it's your name's on it, your identification, it's in the system.
Or you would have had to have that test repeated at campus, which increases the cost of healthcare. You know, in diagnostic procedures like that, exposes you to more radiation, which is not something you want to do. So we all hear about the cost of healthcare, and it's crippling the country in some respects.
Right.
This helps reduce that cost, and it eventually saves us all money as well as time, and allows the patients to have better service and the physicians to have the information they need immediately.
Excellent, excellent. That is kind of makes you feel good, you know.
Physicians like us, they can even put the order in. I don't know if you remember the old days. Write a prescription for an X-ray, take it, you take it to the desk. Oh, I forgot to bring it. I can't read the handwriting. My son had another test that was ordered by a physician. He just put it in the computer, and when I got to ACMC, all I had to say is, I'm here, here's my name. I said, yep, it's in the computer, come on back. It's really changed.
Yeah, I guess. So you've probably seen a lot of changes since you started out.
I've been around a while. About 30 years, but...
the same with me. I mean, I've seen that too, you know, and it's amazing. Yeah. It's amazing.
And it is about cost containment, but it's more about quality. It's more about quality. Another cool feature, last one I'll tell you, since it's electronic, many providers can access the record at the same time. A year ago, a doctor would have the chart, the nurse is looking for it. Oh, sorry, can't get to it, the doctor has it. Now you can have 10 people looking at the patient's chart at the same time and getting done what they need to done to get patients better and get them home. They love it. It's a satisfier for our staff to say, wow, we don't have to wait for the chart anymore.
Just think about that. It's amazing. It's amazing. Now, I wanted to ask you too. I noticed that my little cheat sheet here that Tina and Elaine provide me. You went digital with the mammogram test. Is that right?
Yes. We are installing digital mammography is this month, and that's a service that's been around a little bit, several years now. I know several hospitals jumped in the beginning and got it. A lot of women demanded that because it was the kind of newest, greatest. But really, the study that confirmed that digital mammography does give better images was just completed, a nationwide study about a year ago. So once those results were out, we decided we're going to make the move, and those will be going in this week. 2 units.
Really?
And it's going to be again integrated into our electronic medical record. We can read the films right on site, or they can be shipped to Cleveland Clinic to be read. So it will provide better care for the women in our community. I've had so many physicians say, you know, we need this service at ACMC, so we are responding to that. It's not just taking the picture though. We are also getting a special device that will attach to the units called Stereotactic breast biopsy. It's a long word. But what that means is, if something is seen, on a mammogram where the physician says, we need to get a tissue sample to really see what's going on. Instead of going to the operating room and having to have a more complicated procedure, a physician will be able to just insert a small needle right there at the machine, and
Really?
less invasive, less painful, and be able to get that sample and get the patient home and get a quicker diagnosis. So
Wow.
we're pretty excited about that.
Yeah, that's state of the art.
It is state of the art. So that'll be up and running this month in December. So.
Excellent. You can go right ahead, Mike. And,
Yeah, I'll jump in a little bit on a couple things. As you mentioned, new digital mammography. ACMC, this could be another headline for the year. While healthcare is a rough business and it's hard to remember, our hospitals in this county, all of them are nonprofit, so we take any extra that we make and we put it back into the hospital. And this year we put about $7 million back into equipment.
Is that right?
Yeah, for equipment. Much needed. A lot of it's replacement, like mammography. Another one is going to be MRI. A new MRI will be coming at about $1.5 million. That'll be coming in the new year. And just purchased a lot of equipment to help really increase the level of technology, so you don't have to leave the county anymore. You can come to ACMC and have the best of the best equipment. And 1 year, $7 million, I think shows our commitment to
Sure.
where we want to go with ACMC.
I don't think people realize how many employees you have.
Yes.
Can you tell us again?
Yes. There's 1,200 altogether. Between, as you know, we're a system. We have, the components are the acute care hospital, which you usually hear a lot about,
Right.
Glen Bay. I think
Right,
people
right.
pretty much know Glen Bay. We have a very active home health with about 100 people. And between our new physicians, our 30 physicians and their staffs and employees, that's another 100 people. So we're right around that $1,200, or 12, money's on my mind. 1,200 people that generate, this is why we're here, that generate about $50 million payroll every year back to our employees who live in this community.
50 million?
50 million every year.
Wow.
So it's about, that's what I find satisfying, not just the healthcare piece, but we know we are providing good living for people, and that's why it's important that ACMC stays strong. So my message to the community is, we appreciate your support of ACMC because it truly does put the jobs back into the community, and that money flows to Conneaut, to Jefferson,
Sure.
to Geneva, to Ashtabula, to Andover, all over the county. So, I feel, I got to tell, I feel a real burden that's what we have to keep going, and that's why ACMC needs to continue to be strong.
Of course, you also have Snap Fitness, too. Or not Snap Fitness,
Premier.
I'm sorry.
Premier.
I'm sorry, yeah. As well. So there's more employees even there that are connected
Yes.
to you.
Yes.
Which I'm getting rave remarks about Premier. Of course, my wife goes there. That's one of the reasons. But
Tremendous.
So you have the inside scoop.
you have the inside scoop, you
Right.
know. I wanted to ask you, go back to the digital mammography.
Yes.
Like she has to take her annual test,
Mm-hmm.
and this is where she gets it. But so she would be they would be utilizing the new digital when she does this after the first of the year.
Yes.
Actually,
Yes.
the first patient is next Tuesday.
Is that right?
Mhm.
Okay, so after the first year, that's
Yeah.
when she's scheduled to go
Yes.
in January. So okay, I'll have to tell her
Yeah.
that.
I think the process is pretty much the same. I have a lot of women approaching me and saying, is there anything different about the process?
Yeah, I was going to ask you that.
Yeah, I'm not sure I have all that down, but the process is pretty much the same. It's just the way that the images are processed.
But yeah, as you said, it's more accurate, more
More
clear.
accurate, especially for women with larger breasts. It gives a better picture. And digital mammography has a computer attached to it. So while a radiologist does read it, the computer does a little scan and points out to the radiologist, hey, there's something you might want to look at in this section of the mammogram. So you really have computer kind of scanning it, and a radiologist, so very accurate.
And because it's electronic, you can adjust the contrast and the brightness, so that if the radiologist sees something that is suspicious, he can manipulate that image to get a clearer picture of what it is.
Okay.
You can't do that with regular film.
Okay.
What comes out of the film is what's on the film.
Yeah, if there's a shadow there or something.
Right.
Okay. Interesting. There's something on here, Tina, called 90 and 90.
Yes.
Can you explain that?
I think in the past we've talked about patient experience, and that we really take a customer service approach to healthcare. Back 30 years ago, people judged healthcare based on the quality of care. But truthfully, I have no clinical background. I can't tell you whether or not the care I receive is clinically great or not.
Right.
I know that it will be at ACMC, but I don't really have that knowledge base to make that judgment. But what I do know is how you treat me as an individual. So not only do we focus on being clinically excellent, but we focus a lot on treating the patient as a person, not just as a patient. And 90 and 90 is an effort that we put together in conjunction with the other Cleveland Clinic hospitals to improve our patient experience scores in a 90-day period. And yes, the score is the way we know how well we're doing, but it's not about just getting to that 90th percentile. It's about making sure that we're doing what we need to do for our patients every single day, every time we encounter them. So there's a steering committee for 90 and 90, and we started rounding with the scores. Every 2 weeks, the patient experience scores come out, and they tell us how well we're doing. And we're going and we're talking to the staff, and we round on them at 5 o'clock in the morning, at 11 o'clock in the morning, and then at 9 o'clock at night, so that we hit all of the shifts. And the staff is very excited to see how well they're doing. There's one department has a little competition between the nurses and the physicians, and whose scores go up faster. And it's just, again, it's about doing what's right for the patient from a personal perspective.
That's good. That's a good thing. Because, you know, all of us don't want to go to a hospital if you can help it.
Right.
But once you're there, you want to make sure. And I remember the old days, Tina, when back when I was a kid, I remember you went to the hospital and they had some pretty hard-nosed nurses that just didn't, you know, they did their job, but they didn't have that bedside manner.
When we launched 90 and 90, the example that I used to the groups that I spoke to was, think about it like a restaurant. You have a choice where you go to eat, and you have a choice where you go to receive your health care.
Right.
And let's say there's restaurant A on the east side of town and restaurant A on the west side of town, and they're both the same franchise. You choose to go to one or the other, you know, the menu's going to be the same, the prices are going to be the same, the food's probably going to taste the same. What makes you go back to one or the other is how the wait staff treated you, whether the manager came out to make sure that your meal was fine, if there was an issue that you encountered while you were there, did they fix it for you? Did they make you feel satisfied with the service? It's the same thing with healthcare. You can expect to receive good healthcare when you walk into any hospital, but it's how you're treated as a person that will make you choose us again. And that's what we're focusing on. We want you to choose us because, as Mike said, we are an important part of this community, from the $50 million payroll and just from being here to take care of you.
Right. Very good. Very good. Mike, as we get near into closing out this segment here, I guess we have to ask you, what's 2013 look like?
Well, I'll give you a little bit of taste, but I want to come back on a couple shows, and then as things roll out, we can even give more detail. But as we said, the MRI will be coming first quarter 2013 at about 1.5 million. So we're pretty excited about that. And it's not just replacing technology, but it's going to have new features, and we're going to be able to do types of studies that weren't able to be done in the community before. So we're very excited about that.
Had you been able to do MRI work there before? Yes. You're just updating then?
Yes, we have an MRI now. It's getting old. We've had it for about 14 years. And to be honest, it needs to be replaced. The images are still good. We do a lot of these every day, but there's new modalities. With imaging equipment, as new technology come out, the images are even clearer, cleaner, and easier to read. So we actually, with Cleveland Clinic, we traveled the country. We looked at MRIs across the country to see which had the best images, which ones the physicians and other hospitals liked the best, and we're going to have the most advanced MRI in the system. So we're pretty excited that we're going to be able to bring that to Ashtabula County.
You know, this I've been doing this for so long, mainly in the newspapers, but I was at an affair back, believe it or not, in the 70s, and a guy come up to me and said, there's going to be a machine that eventually, and he was talking about MRIs, but I had no clue. There's going to be a machine that's going to come out. It's going to actually be able to tell you what's wrong with you. And I'm thinking, yeah, right. It just sounded like space age stuff. Now look, we're in an age now where you've had this thing 14 years, and now they've just probably improved everything.
Yes.
You know, so this is great. This is going to be a big addition to your hospital.
It's going to be exciting. There'll be more detail coming out as that comes on live. Another big focus has been, as with all hospitals, is really emergency room care. And we are working to implement some new systems in our emergency department to get patients through seen faster and get them admitted quicker if they need to be admitted, or get them home. So that's going to be rolled out in January, but we see 35,000 patients. And you know, our biggest complaint is wait time. And when you see that many patients, it is hard to move them through. So we need to accommodate even more patients. We're getting busier and busier, and we're going to be implementing systems that will move patients through quicker. So more to come on that, but we know that is going to be very well received for our community initiative.
I'm looking forward to having you back in 2013, because you always bring a wealth of information with you when you come in. This all is very, very positive for your hospital.
It is. It's positive for the community when we can bring these technologies, because it's the reason we exist, Pat. It's for our community, and I think you see what energizes me is bringing this and working with a great administrative team that we have at ACMC and our 1,200 employees to give the community what they're telling us they need for their health care.
I think the last time you were on, Tina, I had asked you about you're not doing the Oscar show this year.
Correct.
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 And there's something else. Well, it was because it was on Sunday nights.
Because it was on Sunday night, and those of us who need our beauty sleep weren't getting it then to go to work on Monday morning. It will be March 2nd, and we've renamed the event Diamonds and Denim. It is still a gala, but if you want to come in your jeans instead of getting a tux or a suit, or ladies with a gown, that's okay too. It is just about coming out to support the ACMC Foundation, that in turn supports the hospital.
Right.
The ACMC Foundation this year gave $375,000 to the hospital to buy some of the equipment that we were able to purchase.
So you've kind of taken away the glitzy stuff and
no, it will still be glitzy. It just won't be tied to the movies.
Okay. Okay.
What I anticipate is a lot of the gentlemen showing up with jeans and maybe a tuxedo jacket.
Or a sport coat.
Or the same thing for, I might go out and buy a new pair of jeans and get the Dazzler and have some jewels on them.
Isn't it on a Saturday night too?
It is, March 2nd. Okay. And what we are doing going forward is it will always be the first Saturday in March.
Okay.
Oscar night moved based on when the Academy of Motion Picture Arts and Sciences decided to hold it. So this is something that year after year you can mark your calendar for the first Saturday in March, and it will be the event to support the foundation.
You know, it's ironic that you mentioned that, because one of the reasons I never went to it was because it was Sunday night.
Yes.
Getting up early in the morning, there was no way, you know. But
so we'll expect to see you there.
Will this be at the lodge?
It will be at the lodge again, yes.
Okay. Well, you might just see me there on a Saturday night. We'll have fun.
Yes. There will be music and dancing, the auction again, great food, some surprise entertainment.
Really?
Yes.
Okay. All right. So keep us informed.
Definitely.
Give us some updates on that. Mike, I want to thank you again for coming in. Always a pleasure having you on with Tina. And it looks like you had a wonderful 2012. It looks like you're having even a better 2013.
I'm excited. Thank you, Pat. You've been so kind to me this year, and I really appreciate you giving us the opportunity to tell our story. More good to come.
Good. That's good to hear. And I want to wish you both a very Merry Christmas.
Merry Christmas to you as well.
Same to you.